Good morning, everyone. Bob Ravenscroft for the March 25th media briefing here. As you can see from the numbers, things are looking great here. We're still very busy. We have nearly 500 patients here at midnight. But of those 500 patients, only 11 of them are COVID patients. And boy, what a change. Of those 11, 3 are in the category of where they're no longer infectious but still ill. As far as the level of care for those 11 patients, 5 of them are in the intensive care unit and 2 of them are still on ventilators, predominantly from Lancaster County, just 3 from outside. So I think that's been pretty consistent for the last several months or so where things have been more locally generated. We did have a couple of questions that came through today. I'm going to read through them all at once because there's some overlap in them. But the first one was, could you explain in layman's term what efficacy means, why it's important in discussing COVID vaccines? There have been some reports about vaccinated people who have tested positive for COVID. Can you explain why someone who has been vaccinated may not be fully immune? Have we had cases like this in Lincoln? And even if vaccines can't 100% prevent the contracting of the virus, can they prevent severe spread and death? So let's start with efficacy. I guess the simplest definition of efficacy, how I would explain it, is you have a desired result and an intended result, and how do they match up? So it's what's that ability to produce the desired or intended result? As we talk about vaccines, this vaccine, and frankly, I want to start by just saying, on our Facebook page, we did a couple of live sessions, one with Dr. Kevin Richmuth, a pulmonologist, and another one with Dr. Robert Purcell, a cardiologist. I'd encourage you to go back and take a deep dive. They're going to give you more precise answers than I'm comfortable giving as a certainly not a physician, but they'll answer these, and I'll try to give a high level. But basically, with this vaccine, it's intended to keep you from getting really sick or dying from the virus. And in this case, the efficacy of the vaccine is working really well. You just saw from those numbers that hospitalizations have fallen. Deaths have really dropped here and across the state. And I think you can really point to the number of vaccines that the most vulnerable people are getting and good adherence to the non-pharmaceutical interventions that many communities across the state have taken pretty seriously. Our guard is probably still up because of the variants. Everyone's hearing about the B.1.1.7 and where it's growing in the country. I think Dr. Nora has said there are many variants of COVID right now, so all of those are being watched, and there's a significant number in Nebraska as well. But so we got to keep up those good non-pharmaceutical interventions. All of the literature and what the physicians were saying in those Facebook Live sessions as it relates to efficacy is they are, depending on the version of vaccine, 75 to 95% effective in keeping you from developing those severe symptoms and essentially foolproof against severe complications and hospitalization. So the efficacy of the vaccines are really, really, really effective. As far as reports of people who have been fully vaccinated who have then tested positive for COVID, what I can tell you is, and we responded to one of your colleagues in the media yesterday, that at Bryan, of our 5,800 vaccinated individuals, medical staff and so forth, there have been 3 cases. What is unclear is where that happened. Were they perhaps positive before they got the vaccine? Did it occur after the first dose? We don't have that granular of data that I'm able to access. What I can say is Dr. Antone yesterday, and all of this information rolls up through the health departments to the state for analyzation, and Dr. Antone said there were no cases in Nebraska for people who had been fully vaccinated through their 2 doses from getting the virus. So that's my best explanation. We have had 3 here in Lincoln where they were at in that stage of virus contraction versus it developing and when they got their vaccine. Just can't tell you. I would I trust what Dr. Antone said, and so I'm surmising it happened either right before they were vaccinated with their first dose or between their first and second dose. Let me see if there's anything else there for that. I think that's it. I would just really encourage people to backtrack if you want more specific answers on that, and from a something that can be quotable by a physician, to go back to one of those Facebook sessions. If you have something you want to dig in deeper there, contact Brad, and we'll try to hook you up with one of the physicians or epidemiologist or someone from our infection prevention team.